One of the most important disease that our pets can have is a cataract, which is a opacification of the lens, which is part of the eye. Lens can be involved in cataract for different aspects and different part of the lens itself. And depending how the involvement of the lens is important, the dog can have problem in visual. Cataract can cause inflammation in the eye, and this inflammation can lead to blindness due to high pressure or retinal detachment or both. So it's important to realize as soon as possible when our dog has cataract and go to a specialist to understand if it's the time to do something surgically, because there is the only way to correct the cataract, or to do some rechecks before to think about any surgery. It's not always necessary to do the surgery, but can be important to understand if there is associated with the cataract inflammation of the eye.
First, to understand the cataracts, we need to understand the normal structure of the eye. So, with me here to facilitate the explanation. Here we have the lens just like we have it, with a few differences with us humans. In dogs, this lens helps in focusing the light. It is an essential part of the eye that allows the normal vision of the animal. This lens has always to remain transparent. The cataract is an opacification of this lens. It could be in the of the nucleus, the capsule, or any other part of the lens. When we have this opacity, we call it cataract. An important differentiation is with the nuclear sclerosis, which is a condition that resembles the cataract with a change in the color of the eye. So we see dogs with this bluish, grayish colors, usually old dogs. It does not mean that they have developed a cataract. It could be a benign condition due to the aging of the lens. This condition is called the nuclear sclerosis, and this condition does not affect the vision. An important distinction, because one is physiologic, the other is pathologic and necessitates a treatment. So what can cause the cataract? Many causes, many etiologies. It can be linked to an injury of the globe. It can be due to some pathologies at the level of the retina. It can be due to an inflammation. It can be caused by diabetes, which is an important cause of the cataract, one that we see almost every week here at the clinic. What the owner can see usually is an eye that is whitish, a dog that is blind or almost blind. It changes, of course, the behavior of the dog, and usually when they come to see us, it is one of those few conditions where the owner has a pretty good idea that it is a cataract, because the eye is white, which is very similar to how it happens with us humans. The dog is non-visual. The diagnosis of the cataract is straightforward. We do an ophthalmic exam, and through this exam we can diagnose the presence of a cataract. We, of course, need to dilate the pupils to be able to see the whole lens, to be able to see first the location of the cataract, because, as I said, it could be in different places of the lens, to see the feasibility of a potential surgery. After we do this dilation, we see many things. One is the presence of the cataract, the diagnosis is there, but then we have to see how the lens is positioned, is if we have any instability, any inflammation, anything that can lower the success rate for the potential surgery. Because the cataract, this opacification of the lens, it's true that the end result is a dog that is blind. It is reversible, let's say, through surgery, but the untreated cataract can have some risks. It can cause an inflammation of the eye. It could lead to the development of a glaucoma with the increase of the intraocular pressure, and all these things need to be taken into consideration when we discuss the importance or the risks of the surgery with the owner. So when we move to the the treatment part of this condition, because we have this in this opacification, we have this lens that is white, so it's like we are putting our hand in front of our eyes. We need to do something about it. The only treatment that is available to us is the surgery. So far, we do not have any medical treatment for the cataract. We cannot prevent it, we cannot treat it medically, and we cannot slow the progress. We don't have any literature that could prove these treatments to be effective. So the surgery remains the only option at our disposal. What is the surgery of the cataract? Well, as we said about this lens, the goal here is to get back transparency in the lens. How we do this is by creating a small hole through the anterior capsule. We go inside of the lens, we use a machine, we use phacoemulsification. Basically, we create vibration, we break up all this whitish material that is inside of the lens. Then we aspirate it all, keeping the so we are left with a lens that is transparent. But transparency is not enough. We have to put in a lens to replicate the role of the natural lens. So we put an artificial lens inside of the lens capsule, and then we close the eye, because then it's of course an intraocular surgery. Usually the dog is visual the same day. We relieved this mechanical block of the light, so the light can pass through, and the dog can see. Before we can do this surgery, we have to talk about an exam that is extremely important to do prior to this surgery. We have to do two things: an ocular echography and an ERG, an electroretinogram. The ocular echography will allow us to see what is behind the lens. Because in a normal dog, a dog that does not have a cataract, we can see with our instruments during the visit anything that is behind the lens, because the lens is transparent. But in the case of the cataract, we cannot, so we have to use ultrasounds. With these ultrasounds, we can see, for example, a detachment in the retina. We can see some vitreous pathologies. We can see the vitreous is this gel here behind the lens. If we have any of those pathologies, we have to take them into consideration if we are going through the surgery. And then we do an ERG, the electroretinogram, and the role of this is to see the function of the retina. So basically we put some electrodes on the eye. Usually the dog is sedated. They don't always cooperate with this procedure. So a very light sedation, we put some electrodes and we send some light signals, and we have a response and a graph that can tell us the function of the retina. Unfortunately, for example, if we have an ERG that is non-responsive, we have a retina that is non-visual, it does not make sense to do the operation, to do the cataract, because even if we can have a transparent lens, the retina is non-functional. So basically we haven't done much for the dog because he is still blind. The retina is non-functional. Let's say the echo went well and the ERG went well. Then we move to the surgery with the cleaning of the lens, the putting of the artificial lens. Then now comes the part that is a little difficult for the owners, which is the post-operative aspect of this surgery. The treatment of the dog post-cataract is sometimes tough. The therapy are usually drops. We put up to 6 times a day, depending on the surgery. We have to do this for a few days. We see them the day after the surgery, the day after, usually 3 days after, then every week. We have a protocol of follow-ups that we do with cataract, because it is very important to monitor the post-surgery. When we talk about the surgery, we have to talk about the success rate and the complication. The success rate now is high. 20 years ago, it was extremely low, but now I think we are over the 90% success rate. So It is not the cataract of before. Now we have the instruments, we have the research that allow us to perform the surgery in better conditions with better results. But even with this high success rate, the complications of the cataract are important. If we have complications, of course. The main one being an increase in intraocular pressure, so the development of a glaucoma. And that's the main reason why we see the dogs as much as possible after the surgery. The second thing with the increase in intraocular pressure is the inflammation. Now, the inflammation is normal to a certain degree after the cataract surgery. We opened the eye, we put some vibration, we did some work inside of the eye, so a certain level of inflammation is considered acceptable. Of course, we put anti-inflammatory drugs and we monitor this inflammation, because to a certain degree it is acceptable, but beyond it, it could lead to other complications, and we want to avoid this. Why I have spoken longer about this post-operative treatment, because when we want to choose a patient for surgery, many times the owner would think that the dog being old is not a good candidate for the cataract surgery, which is not technically true, because this cataract surgery we do in a lot of our older patients. As we say, the age is not a disease. With age, we can have some diseases that can develop. So prior to the surgery, of course, we do a full blood work, we do an echography of the heart, and we do some exams that would allow our anesthesiologists to do the best work they can do and to lower the risk of anesthesia to a minimum. So it's not really the age, the limiting factor. Usually the limiting factor are the treatment, the post-op treatment. Some owners cannot do the treatment. So for us, we have to be very clear in when I explain to the client that this surgery requires this kind of post-op therapy and they cannot do the therapy, we have to consider, is it feasible? Is it worth doing? Because if we do the surgery and everything goes well and the treatment is not done, then the complications will almost certainly happen. So we have to be aware of the importance of the post-op therapy. But of course, then we have to talk about ways that we can manage this therapy, the ways that we can help. So the treatment is one of the limiting factors, and other factors are ones that we discuss with the clients depending on the health of the dog, the general health, we're not talking just about the eyes, and the condition, the health of the eye. So during the exam, we could see some conditions that would complicate the surgery.